Good afternoon. My name is Chen Nam.
My name is Yin Laam.
My name is Poon Yee Kwan.
My name is Koo Hiu Ping.
My name is Tung Hoi Yan.
I'm Cheuk.
Okay, as we grow older, everyone has a chance to suffer from osteoporosis. So today I would like to talk about what is osteoporosis. Osteoporosis is a disorder of bone metabolism, also decrease the protein and minerals in bone, so it results in diffuse patient bone density, making the bone structure fragile and easily to crush, causing pain and other complications, reducing the patient's ability to take care of themselves. As you can see from the picture on the right, people with osteoporosis will have lower bone density than normal people. Next. As the age grows, the number of people suffering from osteoporosis and the number of fractures is increasing. It has increased by nearly 70% in the past 20 years, from 3,600 cases in 2000 to about 6,200 cases in 2020. Among women over 45 years old on average, one of the 3 women will have osteoporosis problem. In Hong Kong, more than half of women will suffer from osteoporosis after menopause. Next, if you're still confused with osteoporosis, the bone density examination may help you. The bone density examination is a quick way to assess bone health. It can detect osteoporosis, judge the risk of future fractures, and evaluate the effects of osteoporosis treatment. It has an enhanced form of X-ray technology used to measure bone loss. It can measure the bone density of hip joint and spine. The doctor will compare your bone density test result with the bone density of a 30 years old healthy adult to calculate a comparison value, which is called the T-score. Moreover, the greater the negative value of the T-score, the more severe the osteoporosis. Even so, osteoporosis can be treated and prevented through drugs and prevention, so I will give my team members a more detailed introduction. Thank you.
Now I would like to talk about the cause of osteoporosis, which develops when bone density decreases. The body resorbs more bone tissue and produces less to replace it. It can affect both men and women, but due to a sudden decrease in estrogen, it is most likely to occur in postmenopausal women. Estrogens usually protect women's skin osteoporosis. With age, the secretion of sex hormone in the body will also decrease, and osteoporosis and osteoclasts become active. As a result, their anti-parathyroid hormones effects will be weakened. And parathyroid hormones has the effect of decalcifying bones, which can easily cause calcium loss. Next page. There are lots of identified several risk factors for osteoporosis. Some are modifiable, but others cannot be avoided. For the unavoidable factor of age, bone density peak when a person is in their late 20s, and it starts to weaken at around 35 years of age. As a person grows older, bone breaks down faster than it rebuilds. Genetic factors. Having a close family members with a diagnosis of hip fractures or osteoporosis make osteoporosis more likely. For the modifiable risk factor of stress and disease factors, and some drugs or disease can cause change in hormones level, and some drugs can reduce bone mass. Diseases that affect hormones level include hyperthyroidism. Also, unhealthy lifestyle habits such as drinking, smoking, and less exercise will increase the risk of osteoporosis. Next page. For the pathophysiology, bones protect the organs. provide structure for the bodies and storage for minerals, for example, calcium and phosphorus. Hormones and growth factors have a role in regulating bone functions. Estrogens and testosterone have a significant effect on bones remodeling primarily by inhibiting bone breakdown. Cytokines that influence remodeling have also been identified, such as receptor applicator of the nuclear factor kappa B ligand. RANKL is produced by osteopaths that bind to RANK receptor osteoclase, leading to the activation and maturation of osteoclase and culminating in bone resorption. Resorption. Capucin case is selected by activated osteoclase during the bone resorption process, resulting in the degradation of bone matrix and breakdown of minerals, components of bone tissues. Let's move to Stella.
Oh, thank you. Now I will talk about the signs and symptoms. For signs and symptoms of osteoporosis, there are usually no symptoms in the early stage of bone loss. If symptoms usually appear early, the symptoms may be receding gums, weakened grip, and vitiligo. When the patient's situation does not get better, their bones become thinner and weaker. Also, falling down, sneezing, or coughing, it will raise the risk of fracture too, so they will not know their condition until after the fracture. Then, fracture is usually the first sign of osteoporosis. Fracture of osteoporosis is mainly happen in fifth bone near the hip joint, vertebrae, or forearm near the wrist. There are three kinds of fracture of osteoporosis, which are hip fractures, vertebral fractures, and wrist fractures. Hip fractures may happen after a minor fall down, but there is no trauma when the spine fracture. Vertebral fractures can cause hunchback and height loss. Also, it sometimes causes back pain. Fish fractures can cause pain, swelling, bruising, and wristbands at an unnatural angle. In addition, when you try to hold an injured hand, it will also hurt. And then I will pass to the next group mate to present the next part.
Thank you, Stella. Let me introduce the treatment of osteoporosis. The goal of the treatment of osteoporosis is the prevention of bone fractures by reducing bone loss or increasing bone density and strength. Unfortunately, there are not any available treatments can cure osteoporosis completely. It is difficult to completely rebuild bone that has been weakened by osteoporosis. We can only use some medicines to decrease the removal of calcium from bones. The most effective medications for osteoporosis are anti-resorptive agents. Bisphosphonates are a member of a class of anti-resorptive agents. It is the most common drug used to treat osteoporosis. Bisphosphonates lowers fracture risk because it inhibits osteoclasts, which are responsible for breaking down and reabsorbing minerals such as calcium. Bisphosphonate also increase bone quality by conserving the bone structure. There are 4 examples of bisphosphonates. I will explain them in detail. The first one is alangulate. Alangulate is approved for the prevention and treatment of postmenopausal osteoporosis and osteoporosis that is caused by cortisone-related medication. Alangulate can increase bone density and reduce fractures in the spine, hips, and arms. The mechanism of alangulate is that it shows preferential localization to sites of bone resorption, especially under osteoclasts. The osteoclasts adhere normally to the bone surface, but let the ruffled border. Alangulate does not interfere with osteoclast recruitment or attachment, but it does inhibit osteoclast activity. Besides, bone formation exceeds bone resorption at these remodeling sites, leading to progressive gains in bone mass. It is given orally in doses of 70 mg per week. The most common side effect of allangelate is stomach pain. Also include nausea, vomiting, constipation, diarrhea. To reduce side effect and to enhance absorption of the medicine, allangelate should be taken with water in the morning and patients are prohibited from consuming solids or liquids for 30 minutes. Furthermore, patients should also remain upright for at least 30 minutes to avoid reflux of the pill into the esophagus. The second one is ricinoate. Ricinoate is used for the treatment and prevention of postmenopausal osteoporosis in women and treat osteoporosis caused by steroid medication. Bone is continually being formed and dissolved. New bone is laid down by self-coated osteoblasts, while old bone is removed by self-coated osteoclasts. The mechanism of ricinoate is that it increases the amount of bone by slowing down the rate at which bone is dissolved. Ricinoate is potent in blocking the dissolution of bone. It is given orally in doses of 35 mg per week or 150 mg per month. The side effect of ricinoate has a headache, joint pain, diarrhea, abdominal pain. Ricinoate should be taken with water. It may have the risk of severe joint pain or bone muscle or bone pain if taken for a long time. Also, it may cause upper gastrointestinal tract disorders, such as dysphagia, esophagitis, or gastric ulcers. So it is important to instruct patients to follow the dosing instruction. The third one is ebenzoate. Ebenzoate is used for the treatment and prevention of postmenopausal osteoporosis. It inhibits osteoclast-mediated bone resorption. The mode of action of ebenzoate on bone tissue is based on its affinity for hydroxyapatite, which is a part of the mineral matrix of bone. Eventually inhibits osteoclast activities and reduces bone resorption and turnover. It is given orally in doses of 150 mg per month. There are some side effects of ebenzoate, such as back pain, heartburn, stomach pain, or an upper respiratory tract infection. You should pay attention that taking this medicine may irritate the esophagus, so it has the risk of esophagitis, dysphagia, and esophageal ulcers. Moreover, these medicines could lower the amount of calcium in your blood, which means it has the risk of muscle spasms, twitching, or numbness in your finger, toes, or lips. Remember to call the doctor right away if it develops any sign of damage to the body. The last one is solanolate. Solanolate is used to treat and prevent osteoporosis in postmenopausal women and steroid-induced osteoporosis. Solanolate is also used with cancer chemotherapy to treat bone problems that may occur with multiple myeloma. Intravenously administered solanolate rapidly partition to the bone and as other bisphosphonates. Localized preferentially at sites of high bone turnover. The relatively long duration of action of solanolate is attributed to its strong binding affinity to bone mineral. Therefore, solanolate is an inhibitor of osteoclast-mediated bone resorption. This is given by intravenous injection in doses of 5 mg per year. A single dose should not exceed 5 mg and the duration of infusion should be no less than 50 minutes. The side effect of solanolate has tiredness, headache, and fever. Severe bone, joint, and muscle pain may occur while on solanolate. Compared with other bisphosphonates, this medication is a low-risk therapy that avoids gastrointestinal adverse event and high non-adherence weights. Now I will pass it to Daisy to talk about hormonal therapies.
Thank you. Hormonal therapy is a treatment that adds, blocks, or removes hormones to slow or stop the action related to the disease. It is not the first-line treatments and risk benefits ratio required. Next page. The first medicines is renoxiphons. Renoxiphon is a generation selective estrogen receptor modulator that medicates anti-estrogenic effects on breast and bone. The effect is management and prevention of osteoporosis for the postmenopausal and high risk in invasive breast cancer women. In addition, it can preserve the bone marrow density. However, they have significant side effects like peripheral edema or half flash or negligible effects on breast cancer. The absorption rate is 16% and it can absorb in gastrointestinal tract and the half-life is 27 to 52 hours. The mechanism of this drug is similar to the next drugs because they are bind to the same receptor. Therefore, I will explain it in the next drug. The second drug is conjugated estrogens. The conjugated estrogens are non-crystallized mixtures of female sex hormones. The effect is prevention of the osteoporosis and remain the bone marrows and reduce the bone loss. The dosage is 0.3 milligram per day and per oral, and the side effects is thromboembolisms and jaundice. And the absorption rate is 60% and it can absorb in GI tract and the half-life is 17 hours. The mechanism of this drug is that it is an anti-resorptive effect that is mediated by estrogen receptor alpha and estrogen receptor beta present in the osteoblasts. Estrogenic actions on the osteoblasts resulted in production of cytokines and other factors that reduce osteoclast numbers, activities, and lifespans. Additionally, estrogen acts directly on the osteoclast, later cell decreasing, thereby prevents the maturation of osteoclasts. Estrogen also have antibiotic effects which include increasing the proliferations, differentiations, and the function of osteoblasts. The third drug is pyrophyron hormones. Pyrophyron hormones is a single trans polypeptide composed of 84 amino acids. It can use in the treatment of the osteoporosis in postmenopausal women at high risk of osteoporotic fractures. The dosage is 50 milligrams per day and per oral. The significant side effects included muscle weakness and bone pain. The absorption at the rate is 55% and it can insert subcutaneous administrations. and the half-life is 1.5 hours. The mechanism of digest is binding to at least two distant high affinity cell surface receptors specific for the N-terminals and C-terminals regions of the molecules, both of which are required for normal bone metabolisms. The N-terminal portions of the molecules is primarily responsible for the bones building effects of the parathyroid hormones. The C-terminal portions of the molecules have anti-resorptive activities and is necessary for normal regulations of N-terminal fragments activities. Now I will pass to IC to introduce other preventions.
Okay, now I will tell you guys some prevention about osteoporosis. From a young age, both men and women can take steps to prevent osteoporosis. First, get the right amount of calcium. There are severe types of minerals in the human body in which calcium is of the highest content. 99% of calcium is stored in bone and teeth, while the remaining 1% is stored in the blood to help muscular contractions and blood coagulations. When the calcium level in blood is low, calcium is released from blood to maintain blood calcium level. If calcium is continuously released, there will be an extensive loss of calcium and decrease in bone densities, making the bone become weak and fragile. Meanwhile, with well-balanced nutrition that may be able to get most of the necessary calcium from the diet and fill in the rest with supplements. Among them, dairy foods have a highest level of calcium, around 300 milligrams, but there are many other sources of calcium, including sardines, and that's around 100 to 200 milligrams. Therefore, the dietary intake recommendations is 1,300 milligrams for men and women aged 9 to 18, as well as women 18 and younger with pregnancies and breastfeeding. Men and women between the age of 19 and 15, include women and pregnancies with pregnancies or breastfeeding, should require 100 milligrams, 1,200 milligrams for men and women 15 and older. For the children, will need up to 1,300 milligrams. Next page. Apart from this, don't forget the vitamin D. Vitamin D can help absorb calcium by gastrointestinal tract and use it to such as drive the buck. It is able to help osteoblasts use calcium. For it increase the activities of osteoblasts. Also, vitamin D is capable of osteoclasts to remove old cells. Then if you are 17 of youngest, use 600 international units of vitamin D per day and 800 international units if you are 71 or older. There are 3 ways to get vitamin D. This is including sunlight, foods, and supplements, as the UV light in sunlight can enhance the manufacturing of active vitamin D. When the skin is exposed to sunlight, the liver and kidneys are responsible for making vitamin D, and exposures to sunlight of around 15 minutes per day is recommended. Exposures of the face and the arms of the legs or 15% of the skin surface is adequate. Likewise, it is also found in small quantities in foods such as liver, eggs, fatty fish, which is salmon, and 45 foods like low-fat milk and margarine. Next page. Next is exercise. Exercise can help stimulate the cells responsible for building bone. When blood and stimulate by external weight in order to resist stress and avoid injury. Osteoblasts and other bone growth factors that can stimulate bone growth to become active, then graduate new bones from a protective line of defense. This kind of stimulation will also accelerate the body's absorption of calcium and bring two bones effective to increase bone densities. Children and adolescents, that is estimated 10% increase of peak bone mass. Children can reduce the risk and osteoporosis fractures as elders by 15%. For elderhood, exercise can help prevent blood cell loss and maintains muscular intensities. Studies have showed women who sit for more than 9 hours a day are 15% more likely to have hip fractures than those who sit for less than 6 hours a day. For the elderly, exercise can help them prevent weak bones and falls, as well as helping to maintain bone densities. Exercise also builds muscular tone and improve balance, thereby preventing falls. One-third of people over 65% are falls each year, and the risk of falling increase as age rises. Overall, most people should aim to exercise for 13 to 14 minutes, 3 to 4 times each week, with some weight-bearing, resistance, and balance exercise in the programs, as weight-bearing exercise like dancing, jogging, and walking. However, people can use the treadmill step machines at home or in the gym room when they are busy. That's also a great way to strengthen bone. As resistance exercise, it is including activities where you move the bodies, a weight or some other resistance against gravity, like lifting weights using elastic resistance band, weight machines, or simply standing and raising onto the toes. As balance exercise, there is yoga, Pilates help to improve intensities, balance, and flexibilities. Also include Tai Chi. It is especially for the elderly. Okay, now I will pass to Stella to discuss the conclusion.
Thank you. Now I will talk about the conclusion. Osteoporosis is a disease which is affecting the woman and elderly most. It will lose a lot of nutrients and raise the chance of fracture in human body. Most of the patients will occur fracture in hip, wrist, and vertebra. There will appear some symptoms like hunchback, height loss, and pain. List. Therefore, receiving appropriate treatment or taking medication can reduce the bone loss and increase bone density in patients with osteoporosis and prevent the chance of fracture. However, receiving treatment and taking medication will not completely recover, but can only relieve the condition. Therefore, early prevention can reduce the chance of suffering from osteoporosis. People can start with daily diets and activities to prevent osteoporosis, such as supplementation of calcium and vitamin D and doing the proper exercise. So that's the end of our presentation. Thank you for listening. And the next page is our reference list. Now is the Q&A session. Thank you.